My name is Samantha Wood. I'm a physical therapist and associate faculty member for BASI Pilates. My studio and physical therapy center is in Pacific Palisades, California. I'm the creator and teacher of BASI's certificate course, Pilates for Injuries and Pathologies. And this course is the product of my experience as a physical therapist, along with the study of Pilates with my mentor, Rael Isacowitz. It became apparent to me over the years in working with a lot of Pilates professionals that a lot of them don't have a medical background, and when they're faced with a client who has an injury or a pathology that they perhaps don't understand, they get very nervous and they're not sure what to do with that client, and they're really afraid of possibly hurting the client or making their injury worse. I've seen both firsthand in my practice of integrating Pilates with physical therapy for over, 17 years now, and also through research that when Pilates is used appropriately, it can help patients recover from their surgery and injury, and it can also help people with chronic conditions function optimally. And I'm going to give you a preview of one of the exercises that we do in our 3-day certificate course, Pilates for Injuries and Pathologies. So this exercise is taken from the knee section, and it's one of my favorites because it's wonderful for clients who may be recovering from knee surgeries such as ACL or a meniscal repair, meniscectomy, and it's also great for teaching patellofemoral alignment. So there's 3 ways we can do it too, and I'm going to have Ed first do what I call level 1. So when I'm first teaching the exercise, he's sitting, or we could say half sitting, on the foot bar, with his heel just hooked over the edge of the carriage. Toes are staying down, and we have him lined up, which is really important, that the kneecap is pointing right between the second and third toes. All he's going to do is press the carriage out. He's going to come into full, what we call terminal knee extension, and then he's going to resist the carriage coming back. So it's perfect, but this time I want you to look down at your knee. So it's a really good way to also teach someone that connection that they may have lost after surgery, so they can really learn what their VMO, vastus medialis oblique, and what terminal knee extension is and why it's important for proper function. And in this position, he can also see and learn about that important alignment, that his kneecap goes right over his second and third toes, not out to the side or in towards the midline. Once he's mastered this level, he can stand up and stand behind the foot bar. So now we're getting into a bit of a more functional position where he's actually standing. So same exercise, but now he's having to use his hip stability on his right side to stand still. And same exercise, he's going to push all the way out till he hits that terminal knee extension. And then a very important part of the exercise as well is that he eccentrically controls the carriage on the way back in. Good. And he's working his hip stability on his opposite side, as I said. And then once he's really advanced, and since he's an athlete, we want to get him back to sport, we're going to challenge him even more. Put something like a spinning disc, perhaps a dyna disc, or a balance pad under the standing leg. You can help him balance if necessary. And same exercise. He's going to push all the way out to terminal knee extension. He's doing an excellent job in making it look really easy, but it is more challenging when you have this instability factor. So in this course, we look at the entire body, starting with the cervical spine all the way down to the foot and ankle, and we talk about commonly encountered injuries and pathologies that you might see walking into your studio. I'll teach you the definitions, what are the causes, what are the symptoms, etc. But what we really focus on is what you as a Pilates instructor can do, specific exercises that will help these certain conditions, and probably more importantly, which exercises or positions to avoid so that you don't exacerbate this client's conditions. So I look forward to meeting all of you in this course.